Welcome back to SYNLAB podcast. I'm Patsy Mokungah and I'm still your host. With me here is Dr. Faleye, and we've been talking about systemic lupus erythematosus, also just known as lupus. So far, we've learned that it's an autoimmune disease. It is chronic and it is
Systemic. Yes.
Meaning it can affect just any organ
in the body. Yes.
So much light has been shed on it so far, but we're going to delve deeper right now. And I want to know, I'm curious to know, like, who can be affected by lupus?
Well, I'll say anyone.
Anyone.
But it's more common in females. Then, I mentioned that we have juvenile lupus too. It's so rare to diagnose lupus before the age of 5, but it's been documented in literature in age 2, age 3. So, and then for the adult type, they will say women of a reproductive age between the age of 20 and 40 is common. Then we have lupus in the elderly, which has been which occurs in individuals between the age of 50 to 65 years.
Okay. Is there any reason why it is more common in women? Do we have any idea?
Yeah, because, women have high estrogen level. That's our hormone. Women have estrogen more, while men have more of a testosterone. So estrogen in women have been said to be immunogenic. It can overdrive the immune system to start, like what I discussed the other time, to start, let me use that word in quote, misbehaving. Yes, it can overdrive the immune system.
Does this mean that women are more likely to have autoimmune diseases generally?
Yes, than men. Because most times in children, before you have one boy, you will have seen 5 girls, 5 to 1. In adults, before you have one man, you will have seen 9 women. So you can see the gap is wide. So it occurs more in the male, in the female gender compared to the male gender. And you know about genetic sex. We are XX
and
men are XY. So that second X in female has also been said to be immunogenic. It can overdrive the immune system. Yes. So, all these are still speculations, but those are the reasons that have been given.
That's why we should be treating women gently.
To
me, it just seems like we need more
women are special. I know men are happy now. Oh, so it's a woman thing.
No, women need more pampering. Okay, so are there misconceptions around this disease?
Yes, there are misconceptions.
Like what?
Yeah, because the way the disease manifests, some people think, especially in our environment, whereby we are religious. Some people will think, some people will think that probably the person has a spiritual attack, spiritual problem. Then there's another myth that this is a disease of the white.
I particularly held that opinion.
Wow.
But I'd never seen it in Nigeria.
Nigerians have it. And I must be honest with you, in our center and some other centers in Nigeria, last year, there was an article that was published on adult SLA where they reported 896 cases over a period of 4 years in 6 geopolitical zones in Nigeria.
Out of all our...
So you can imagine, if you can have almost 1,000 within that short period of time. So it's not something that is rare in blacks. The only thing is that we have under-recognized it. Yes. We don't know about it. We have assumed it's a disease of the white. That's another myth. You feel that, no, I'm a black. This cannot happen. And if you look at the reports from America, the black Americans, it's been reported that it's more common in them than the Caucasians, and even they do have more aggressive disease compared. So that means it is here, but we don't know. We are underdiagnosing it. We are not recognizing it.
That's so interesting. We should be happy that we're having this podcast, and this is why people should like, share, comment, subscribe, so that people will know about lupus and know to check about it.
So it's not a spiritual problem. So because of the way they fall sick all the time, because of the way they pray, it's not a spiritual problem, and it's been documented that it's more common in blacks than in whites. So we should stop thinking that it doesn't belong to us here.
Okay. So how do you know that? What do you look for to suspect lupus? What are the signs, the symptoms?
Let me say there are so many symptoms of lupus, and the unfortunate thing is that it quite overlap with our common tropical disease like malaria. It's possible that the individual feels, I have malaria almost every two weeks, always falling sick, fever, fatigue, loss of appetite almost every time. It could be symptoms of lupus. But there are some that are, that are in our classification criteria. And I would like to talk about those ones, like having sores in the mouth. It's not caused by toothbrush or trauma or anything, but you keep on having, you notice there are always sores inside the mouth, or sometimes we see some on the lips, or just immediately the person opens the mouth, then we see some on the upper border of the mouth. Yes, sores. Then also we have skin rashes. Some
Yes,
could,
that one I know.
yes, some can go under the sun and notice appearance of a new rash on the skin, which we
Does it change your skin color?
Not necessarily, but we know some of our drugs can also do. Yes, some can also, yes, but skin rash from it too can change skin color. Any type of rash that is persistent can be lupus. Any type of rash that is persistent can be lupus. Then another thing is that cough, persistent cough, that people will misinterpret as TB. You are not getting better. Cough all the time, it could be chest pain. Then also, let's still look at this. I mentioned. Let's still look at some other things that lupus can present with. We call something constitutional symptoms. That's fever, fatigue, and loss of appetite, ear loss. You did not go to the barber to barb your hair, but whenever just falls on the floor without cutting it. Anytime we are combing, you just feel that. So those could be signs of lupus. Anybody losing weight that you think maybe this is HIV, and it may not be HIV.
I really feel like this disease is playing catch me if you can. It can be anywhere.
Yes. Like we always talk about, is a masquerade disease. You can see their outfit, but you don't know who is under the clothes. Maybe the person is tall, short, you don't know. Maybe the person is light-skinned or dark, you don't know. And that is why we need high index of suspicion to be able to diagnose these diseases.
Okay, what does high index of suspicion mean?
That means any patient with any physician that keeps coming back because of a particular, it may just be one symptom. We've had cases of children having seizure disorders, convulsion all the time. Yes. And they kept treating, they thought it was epilepsy. They thought it was epilepsy, but it actually, after screening, it was lupus. So it could be persistent headache, just anything that is persistent that makes a patient to keep going in and out of hospital or spiritual homes or religious center. It may be lupus. So we must have an index of suspicion for it by looking out for all these things.
Will you say that this contributes to the misdiagnosis or underdiagnosis of lupus?
Yes, because we have so many other diseases in this environment that present this way. So when they present to a physician, it may take long before you start to think, could this be? Lupus. It's possible you have treated malaria for the past 1 year. Some have even started TB medications for the past 1 year before somebody will think, is this lupus? And the patient is not getting better. Imagine the issue of a convulsion, not getting better on anticonvulsant for almost 1 year. They kept treating, but the patient keeps convulsing until we diagnose. The girl is doing well now. I think she's in nursing school now. Doing beautifully well. We diagnosed her at the age of 14.
I'm very happy to hear that in the middle of all of this, there is hope.
Yes, there is. Once they present on time, early presentation remains the key. Present early, let us diagnose it early. In fact, it's even better when there are no organ involvement, like in the kidneys, whereby they pee in the bathroom and it starts to foam like soap. That means they are losing protein in their urine, or they present with body swelling, starting from the face down like that. Once it is still limited to the skin, or, where you have skin rashes and you have ear loss, that is still very okay. We are able to manage them. But by the time they start to present with organ, like a stroke, they could present with stroke. Not everybody with stroke has hypertension. It may be from lupus. So we have to have high index of suspicion for this disease.
I think if there's one thing that has stuck with me from the discussion so far, is that we have to have high index of suspicion.
Yes.
I'm not very familiar with that term before now, but I'm happy that I've learned it.
That means you have to be suspicious.
Yes. Of it. And knowing that lupus can affect almost anybody in any age range, and more importantly, more women.
Yes.
That's very, very educational. So I'm sure our audience have learned more about systemic lupus erythematosus, and we'll continue to learn more. So stick around because we have even more depths to delve into. Alongside with that, please remember to like, share, comment, subscribe, tell everybody about SYNLAB podcast.